We have Alex Munter with us today. You've been here on several occasions wearing a lot of different hats.
Right.
But
I've been recycled into a new role now.
It's a wonderful new role. Very exciting coming in as the CEO of CHEO.
Thank you.
This, for you, you said, is just the job of a lifetime.
Oh, it's such an unbelievable opportunity. You know, I think everybody, I grew up here, and I think everybody in our region knows that CHEO is an organization that's just driven by people with compassion, with skill, who care, who make such a difference for kids and families. And so to be able to join that team, and really your job as CEO is to make sure that folks have the resources they need to do the best job possible for kids and families. So that for me is it's just a great honor, and very excited to get started there.
So you get started, and it's crazy when you're thrown into the fire, because your first couple of days on the job, you're thrown into a situation where we have 3 cases of C. difficile, and you're trying to keep that contained. What is it like to be thrown into a situation like that, and what's happening right now at the hospital?
Well, you know, in my previous role at the Local Health Integration Network, we've been working on the issue of infection control in hospitals. So I came into it with a bit of context and experience around that. I've been very impressed by the teamwork, the infection control team, the environmental services, the cleaners, and the nurses and physicians working together to make sure we really go above and beyond the regulations that are there from the Ministry of Health. And I was really pleased to see in the media some independent experts from Toronto really praising CHEO for being very transparent, being very clear about what's happening, sharing information, and working really hard to make sure we support the four young people now. There have been no new cases since the weekend, and we've stepped up cleaning, stepped up surveillance, and all precautions. So you know, C. difficile is a tough one, and it's an issue for hospitals generally. And I think we do need a bit of a global strategy, for example, around antibiotic stewardship and some of the kind of the root causes here.
You're learning a lot, you know, and just coming in and into that situation and understanding what's happening. For you, you wanted to have a town hall, a meeting with all the staff, so that you have the opportunity to get to know all the way from the physicians down to the people that are working at the front office.
Yeah, and so I've started to do that. I went in Monday morning first thing, and was on the wards with again with physicians, with nurses, allied health, support staff, really. Listening to what people have to say, getting their perspectives on what the issues are and what the priorities are. Going to have a town hall with all staff in the cafeteria this afternoon, and again, really just getting to learn the organization, the people from the inside. Like everybody, I've admired it from the outside, and in my previous roles have worked with CHEO in different ways. But now from the inside, getting a sense of the strengths and the opportunities of the organization.
There's so much praise for CHEO here in our community. Oftentimes we kind of look at Sick Kids in Toronto as a different branch. Are we able to get CHEO to that people really think of us, and is that part of your job to be able to really put CHEO on the map in so many different aspects?
Well, and you know, the interesting thing about Sick Kids, which is such a remarkable asset for the whole province, because really it is a provincial resource, is that their primary mandate is around that tertiary complex care. CHEO does that, but it also has a big community mandate, and CHEO has a real role in bringing care closer to home, and has programs that operate in communities across our region, in schools across our city. And so, you know, the way to think about CHEO is that it's a children's health system. It's anchored in acute care and in that high quality complex care, but also has research, has teaching, and has those components of community care that reach out and help kids and families across our region. And
you're going to be seeing a big, you say the rise, colder weather, we're going to start to see a lot more visits to emergency.
Yeah, this will be peak season, and there's measures being put in place to try to manage that surge and be able to get people through as quickly as possible, because nobody likes to wait around in a hospital.
Congratulations again.
Thanks a lot. Good to see you.
All right, we have to take a short commercial break. We're going to be back at top of the hour, 8 o'clock news headlines coming away. 7 o'clock news headlines coming away right after this.